But Dr. Golden, this morning we have an interesting topic. The flu season just seems to be very, very aggressive. And it's kind of a little bit of a somber note in regards to our Healthy and Wealthy Wednesday topic this morning. The flu has taken the lives of a 20-year-old Arizona mom, a 21-year-old Pennsylvania fitness enthusiast, a 51-year-old Massachusetts mother of two in recent weeks. A simple runny nose and light cough are known to take the lives of children under 2 years old, but healthy young adults are dying during this year's flu season. Experts say this season is more severe than in past years. Several factors are contributing to the rising flu death tolls sweeping the nation. The Centers for Disease Control and Prevention reports the flu is widespread everywhere in the U.S. except for Hawaii and the District of Columbia. Hospitals are having a harder time treating patients with the flu, mainly because of the H3N2 virus that is dominating circulating strain. It hits humans harder than other strains, and scientists don't know why. According to a recent analysis in The Atlantic, vaccines developed for this year's strain are only 10% effective against the H3N2 virus, also commonly known as the Australian flu. Doc, have you seen more and more of these articles, and what do you think is going on with this aggressive flu?
Well, I think this article is dead on. I think it's incredibly accurate. What happens is the flu is a virus, and it circles around the globe every year, so it always comes to our area, or usually comes to our area not until like late December, January, February. So this year it even arrived a little bit early. But anyway, as it goes around the globe over the course of a year, it mutates. So what happens is some very bright, intelligent scientists try to figure out which strain is going to be, it will have mutated into by the time it arrives again for flu season in the U.S. And not every year do they get it right. And it appears that this year they kind of missed on it. And also this particular mutation, which is called H3N2 or the Australian flu, is a virulent strain, meaning that it's more aggressive, it's more difficult, and the flu shot hardly provides any immunity against it, although it does provide some. For that reason, it's good that people still consider taking their flu shot.
Now, I even read an article on some of the ER facilities, emergency rooms, that were saying, hey, if you got a flu, don't come to the ER. All you're doing is just stacking it in here. There's already too much traffic. Stay home and try to treat yourselves. Did you see that article in the local news?
No, I did not. I regret that I didn't see that. What our practice is doing is we're just kind of keeping an open door, so if people need to come in, they can. It's a frustrating problem because, it's a viral illness. Antibiotics don't work. Patients think an antibiotic will work, and if they're prescribed one, it's more of a placebo effect than anything. The other thing that I see as a problem is there's a medication called Tamiflu, and I think most of us have heard of Tamiflu. And for Tamiflu to be effective, you're supposed to start on it within 48 hours of the onset of the symptoms. And then what I've read about Tamiflu is that all it really does is shorten the duration of your illness by approximately 24 hours. So I'm not real crazy about prescribing it. Once in a while, I'll prescribe an old medication. It's the advantage of being a approaching senior citizen doctor, is I know these old ones. There's a drug called amantadine that does have some effect against viral infections.
I mean, I'm trying to figure out as far as preventative measures for the flu. I mean, obviously there's the flu shot. But, I mean, is that really the only way to stay away from the flu?
Hand washing is imperative. It's just really good to keep your hands clean. especially when you're touching objects that might have been touched by somebody who was infected. It's very important to be sure and hand wash. In the office, what we do is if a person comes in coughing and sneezing and we think they have a cold or the flu, we actually put a mask on the patient, which is what we call reverse isolation, so that that person doesn't infect other people in the waiting room, nor pass the virus on to me either.
Yeah, is there a common, almost like a perception that sometimes people think they have the flu but don't have the flu? When do you really know that you've been diagnosed with the flu?
Well, we do a nasal swab in the office. It's the same swab that they do in the emergency rooms. And if the nasal swab comes out positive, then of course we can say that it was the flu, but we usually don't know for a day or so after we've done the swab because we have to send it to the lab. So it's really a constellation of symptoms. It's primarily an upper respiratory disorder manifested by a sore throat, cough, production of sputum, fever, and muscle aches. For me, that's usually what tips me off that it's probably actual flu when a person comes in and says, yeah, I got aches and pains all over, and they're not my usual aches and pains, and usually that's caused by a virus. And the other thing that's important for me to diagnose flu is I like to see a fever, an actual fever.
All right, Doc. Well, we've talked about the flu here this morning. Coming up, we got our Best of the Best awards for business here in Kings County. But before we do that, Dr. Golden, what do we tell our listeners and viewers every Wednesday?
Well, if you feel up to it, I would like it if you would still consider taking a walk today. But be careful. Don't want anybody to become ill and have to be careful of this fog.
There it is. Dr. Golden, thank you so very much for joining us this morning, and we'll talk to you next week.
Okay, thanks.
All right, that's Dr. Golden. His information is here on the screen right now, 559-432-0716.